Good afternoon. Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute. So today we are going to discuss one of the role plays that is basically about migraine. It's a very simple role play. So there is a boy or a man, 31-year-old man or woman, complaining of severe headache and is demanding medication for pain relief. She is clearly distressed and seems to be in a hurry. So somebody is in extreme pain. She is in hurry, so she is demanding medication. So you being a nurse, first of all, our job is to collect the patient's history. So we will ask, so what is the onset of your pain? So when do you feel the pain happens? What are the triggering factors? How much is the pain? Then inquire about patient nature of work. So whether you are doing stressful work or not. Preliminary diagnosis of a migraine. So you can say that maybe you are having migraine because of the stress, as you have told me that you are working as a manager. Then persuade him for 30 minutes that basically he needs to wait for the doctor for 30 minutes because only doctor can diagnose the problem. Reassure him or explain what is best. I have always told you, always write the first line. So the first line, good morning, my name is BKM, I am a nurse over here, how may I help you? Simple. So अब मैं आपको टॉपिक बोल के दिखाता हूँ. Now I will go through the topic. Good morning. My name is BKM. I am a nurse over here. How may I help you? Well, nurse, see, I am having severe headache. I need the medication. Well, I do understand that you need the medication, and I have got your point that you are having headache. But before giving you any medication, I need to ask you some questions. May I? Well, nurse, see, I am having extreme headache. I just want medication. Just let me have the medication and let me go. Well, I am sorry, I cannot prescribe you medication because doctor is the authorized person to prescribe you the medication. But yes, I need to collect some history from you so that I can give this information or convey this information to the doctor, and doctor will diagnose you and will give you the right medications. But nurse, why are you wasting my time? See, it is not wastage of time. It is the medical protocol. And we being medical professionals are all bound to follow these protocols. So may I ask you some questions or few questions, please? Yes, nurse, you may. Okay. First of all, I would like to know about the onset of the pain. Any particular timings of the pain? So when do you feel? And when was the first time did you have this kind of pain? Well, nurse, this pain is going on for almost 2 weeks, and it's not getting subsided. It kind of becomes even worse during the morning hours or the late evening hours. Okay, so have you noticed any kind of triggering factors? Yes, whenever there is any I when I am in the front of sunlight, or whenever I am working in my office, sunlight is crossing through the glass and falling on my head, or whenever I am stressed. Okay, so I have noted 2 points, that your pain is ongoing since last 2 weeks, and also it becomes worse when it comes to the sunlight and other factors, or when you are in stress. Am I right? तो उस पॉइंट्स को रिपीट करो जब आपके पास टॉपिक छोटा है. सो यू नीड टू रिपीट. ओके. One more question is there that I would like to ask. How much is the pain? Is it like severe, moderate, or mild? Well, nurse, I have already told you it's severe pain. Okay, then I will give you a pain scale where 0 is the minimum and 10 is the maximum. So can you please rate your pain? Well, my pain is 11 out of 10, nurse. Like, why don't you understand? My pain is 11 out of 10. It is extreme pain. Well, I am sorry to hear that. Now, I would like to ask you one more question, that what is the nature of your work? Nurse, you are wasting my time. I'm telling you, my pain is 11 out of 10. Why aren't you giving me the medication? Well, I have already told you, being a nurse, I am not the authorized person to give you the medication, so you need to hang on. And I would like to tell you that basically, I need to ask you about your nature of work. Okay, well, nurse, I work as a manager, and do you feel any kind of stress at your workplace? Yes, obviously, there is a lot of stress as I am working as a manager. So, okay, after listening to all your answers, I feel, or your preliminary diagnosis is of migraine. That probably you have migraine, which might be triggered by stress. Well, nurse, no, I cannot have migraine. It's just about I'm having headache. Well, as I have collected your history, you have told me that you are having pain since last 2 weeks. Then there are triggering factors. So these are the factors, and stress is one of the important factors which commonly leads to migraine. So whatever you have told me, according to that, it seems to be migraine. So you need to wait for 30 minutes so that doctor can do the appropriate diagnosis and can prescribe you the medication accordingly. Well, nurse, why don't you understand? I don't want to see the doctor. Well, please understand, it is for your benefit. Meeting doctor is very important because he will make the appropriate diagnosis and he will prescribe you the right medication. Well, okay, nurse, then that's fine. Okay, so please wait for the doctor. And meanwhile, I'm here with you. And here is a glass of water. Have this glass of water and take some deep breath. Doctor will be here very soon. And I reassure you that there is nothing to worry. Doctor is on his way. I have already informed him and he will give you the right medications. Is it okay? Well, all right, nurse. This is how you do your role play. So do your role play in the best way. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not until now for the best OET sample videos. Thank you.